everyone, I'm Eve and I'm an assistant psychologist at Private Therapy Clinic, and today we're going to be discussing insomnia and some tips that you can try out to try to overcome it. Now, insomnia is a very common problem and is defined as lack of sleep despite giving ourselves ample opportunity to get enough of it, and this is normally because we're spending long periods of time lying awake in bed, being unable to get to sleep in the first place, or waking up throughout the night, or waking up too early. And now, just because it's a very common problem, that's not to take away from how distressing it can be. Obviously, the fatigue associated with it can put a real strain on our work lives, our relationships. It can make us feel very irritable. And a really common concern amongst insomnia clients is that something really serious is going to happen as a result of their lack of sleep. Like they're going to become very seriously mentally or physically ill, or they're not going to be able to keep up with their day-to-day responsibilities, and that other people are going to start to notice their lack of sleep. So, as I mentioned earlier, I'm going to be sharing some tips with you to try to help you overcome it, and they're all based on the Cognitive Behavioural Therapy model of treating insomnia, and they're all quite practical, so you should be able to feel really proactive in your recovery from this. Now, the first tip is going to sound quite counterintuitive, but hear me out on this one, and it's actually going to be to get up. And the reason for this is that with insomnia, we often spend long periods of time lying awake in bed, being unable to get to sleep, checking the phone, thinking, oh my goodness, we're only going to have 3 hours of sleep until we have to get up, and tomorrow's going to be awful as a result of it, and getting increasingly stressed and anxious about this. And over time, over a number of days or weeks, or however long the period of insomnia has gone on for, our beds and our bedrooms become associated with these feelings of stress and anxiety and alertness, as opposed to feelings that are much more conducive to sleep, like feeling relaxed, feeling calm, feeling sleepy. And so we really want to try and break that association that we've formed in our brains between the bedroom and anxiety. So, as I mentioned earlier, the best thing that you can do in these scenarios is, if you've been lying awake in bed for more than 20 minutes, is to get up, go to another room completely, and perform a relaxing activity like watching the TV quietly or reading the book or whatever you find really relaxes you. After a period of time, half an hour or however long it's taken for you to feel really, really sleepy and like you're going to be able to fall asleep quickly, then it's a good idea to return to your room and try to go to sleep again. But, if you're spending again more than 20 minutes trying to fall asleep, then you should repeat this procedure until you can fall asleep within that 20-minute window. And that's really going to increase the amount of time we're spending in bed actually asleep, and really strengthen that association in our minds between the bedroom and feeling relaxed and feeling like it's a place where we go to sleep quickly, as opposed to a place where we find it really difficult to go to sleep and we're really stressed as a result of it. This tip can kind of be applied to other areas of our life as well. So in general, the bedroom just should be used for sleeping and having sex. We shouldn't work in bed if at all possible. We should try and work in a completely different room to our bedrooms. We shouldn't worry in bed. We shouldn't watch TV in bed or read in bed. We really should just use it for sleeping, because we're really trying to strengthen the association between our beds and falling asleep quickly, as opposed to doing a whole array of other activities that we tend to use our bedrooms for. So the next tip is going to be to try to minimise our sleep compensatory behaviours. So that's things like taking a nap throughout the day, waking up much later, or going to bed a bit earlier to try and catch up on sleep that we feel like we've lost the previous night. Now, this obviously sounds quite logical. We're catching up on sleep, so we feel less tired and more able to get on with our day-to-day lives. But the thing is, when we engage in these behaviours, we're obviously satiating our need for sleep a little bit in the short term, so that when bedtime next rolls around, our drive for sleep is reduced, and this is thought to kind of perpetuate our insomnia and these long periods of time that we're spending lying awake in bed and being unable to sleep, because we're actually not quite as tired as we need to be to fall asleep quickly. So the best thing you can do in these scenarios is to really refrain from engaging in these sleep compensatory behaviours, because whilst they might make us feel a bit better in the short term, they're actually perpetuating our inability to kind of fall asleep within a set window throughout the night and pushing us out of a regular sleeping pattern. So as I say, we should try and get up at roughly the same time every day and go to bed at roughly the same time every evening. Another sleep compensatory behaviour that a lot of people engage in is having some kind of alcoholic beverage or a nightcap before bed So they feel more relaxed and like they're more able to fall asleep more quickly. And whilst again this might seem like a good idea in the short term, alcohol has been shown by numerous research to really interfere with our REM, so rapid eye movement phase of sleep, which is associated with really important processes like consolidation of memories, emotion regulation, and learning. And alcohol in general just really interferes with our sleep, so it contributes to wakefulness throughout the night or waking us up much too early. So in general, we should really try and refrain from using alcohol as a sleep aid, especially if we're going through a period of insomnia. The final tip is going to focus on tackling the mental state that often accompanies a period of insomnia. Now, many insomnia clients report feeling obviously exhausted throughout the day because, there's been a number of nights where they've been unable to get enough sleep. But the minute they get into bed, they suddenly feel incredibly wired, full of energy, and like they're incredibly anxious, and their mind's suddenly spinning at 1,000,000 miles an hour, and that's what's keeping them awake for these long periods of time. Now, the reason this happens to a lot of insomnia clients is that they're often very busy throughout the day, working really late into the evening or socialising late into the evening, that when they get into bed, this is the first time that they're in peace and quiet, and it's the first time that they've allowed themselves any problem-solving time, any time to process what's gone on in the previous day and how they're going to be able to manage the following day. And of course, that's why our minds become so active when we first get into bed, and this actually kind of keeps us awake for long periods of time. A really effective way around this is to set aside some time in an evening where we're going to constructively and proactively deal with these worries so they can't keep us awake for long periods of time in the evening. So what I would ask you to do is to set aside 10 or 20 minutes every night, and on a piece of paper, divide it into 2 columns, and on the left side, write down anything that has come up for you during the day, anything that's worried you, or just anything that you feel like could keep you awake potentially for long periods of time, or any worries that you have for the following day, so any particularly pressing tasks. It could be a university assignment that's particularly pressing, for example. On the right hand column, we're going to write down how we're going to tackle these problems. So for the assignment example, for instance, it could be I'm going to read 3 articles and make notes on them, something reasonable and realistic that we can feasibly do the following day to tackle this problem. Obviously, some problems aren't going to have a clear solution, and that's absolutely fine. We just need to write that down. So I don't have a clear solution for this problem at this moment in time, but I will deal with it tomorrow, or I'll seek help from someone, or whatever you're going to do to try and tackle this problem. And that should really help you feel like this worry that you're having in bed isn't productive. Worry is already being dealt with in your early evening procedure, and the worry that you're having before you're going to sleep is actually defunct. There's no constructive purpose to it. So that should really help you quiet your mind before going to sleep, and hopefully help you get to sleep much quicker. So thank you very much for watching this video. I hope these tips have been helpful to you in some way. And of course, if these problems do persist or you feel like you need further help with them, it's always a good idea to seek professional advice. And Cognitive Behavioural Therapy for insomnia is of course a service that we offer at the private therapy clinic. Many of our practitioners are well versed in this method.